Thank you for joining part 4 of our podcast series where we are working with Ms. Jill McNeely, a retired breast nurse navigator. My name is Leah Wyrick. I'm the CEO and founder of 3 Strands Recovery Wear and creator of the Resilience Bra, a post-operative recovery bra for breast cancer and breast cosmetic surgery patients. On our last episode, we discussed what to know before surgery, and today we want to discuss what you should know immediately following surgery. We're going to dive into your recovery, starting with when you wake up and what the first 1 to 2 weeks post-op looks like. Oftentimes, we hear that women feel that they don't know a lot about these things and what to expect. And I know from my mom's experience as a breast cancer survivor, having had a mastectomy, she also had some of those burning questions that I think she wished she would have known as well. So I'm going to pass it over to her to talk a little about her experience after her mastectomy, waking up from the operating table, and what recovery looked like for her. Mom, you want to take it away?
Yeah. It's a blur. I'm just going to tell you, that time is fuzzy for me. And I think there's a reason for that. I think that's part of the plan to take some of those memories away. But there's a lot of what I do remember is relief. Number one, relief that hopefully my cancer is gone. The adjustment of now gearing up for recovery and knowing what that was going to look like, trying to kind of visualize that. Not going to lie, a feeling of loss of my femininity. I dreaded that. Gosh, I dreaded that. That was hard. But then again, switching to fight mode and moving forward. It's done. It's gone. Now what do I got to do? It was just a constant kind of thinking about what's the next thing that's got to happen for me to get on the other side of this. So a lot of, I can't, everyone's going to be different. Everyone's going to feel different. Like I said, it's blurry for good reason, but some of those emotions, like the ones I just mentioned, you will remember those. But there's some tactics I think we should get into that will help women, again, feel like they are as prepared as possible for what that time will look like immediately following surgery. I don't remember pain. I don't, honestly, I don't remember pain. I remember discomfort, but I don't remember a ton of pain. But discomfort for sure. But Jill, what are some things that you have seen women experience or have heard women say about immediately following surgery and that it is a little scary. I won't lie to. There's a lot of things happening up there when you wake up. So there's tubes, there's lots of things being monitored. But Jill, what do you think?
Well, I think you hit on one of the biggest points in that it's your cancer-free day.
Mm-hmm.
So you do have that relief of, okay, that's behind me. Now what's next? So, immediately for the lumpectomy patient, most of them are going to have some small incisions, a small dressing. They're going to go home that same day. Their activity is not really very limited. They can do moderately what they want to, but pretty much resume everything normal except for tub bathing or swimming in a lake or those kind of things. I do want people to know that if you are taking pain medicine, make sure you're drinking plenty of water, because I think some people may not be ready for the constipation that may happen with some pain medicine. So it's really important to keep your nutrition up. For mastectomy patients, certainly they're going to have a bulkier dressing. They're going to have a drain or two per side. They're going to have numbness in their chest. One of the things I can tell you over and over again that patients would tell me is, I'm really not in the pain I expected. Well, part of that is because they've cut some of the nerves in your chest.
Yeah.
Mm-hmm. So you don't have that, but you have incisional pain. Mm-hmm. But it's not like, say, a cesarean section where they've cut through muscle. Mm-hmm. They take everything down to the chest wall, but they don't cut those muscles. The drain, you need to make sure that before you leave, whether that's outpatient or inpatient, that you know how to empty that drain. You know what that drainage should look like. You have actually emptied that drain at least once by yourself. You may have tons of people at home to help you with that, but you need to know how to do it and how to comfortably handle that. So typically the drainage you're going to see the first couple of days is real bloody, red, darker blood, red blood. And that becomes lighter and lighter and lighter as the days go on, both in amount and color, to the point where before they take your drains out, you're going to have just a small amount of drainage and it may be somewhat clear. But you need to be comfortable handling that drain. Most of them look like the end of a turkey baster. And that's pretty much how you do it. You just take the plug out of the top, turn it over your container to measure it in. And that is something to make sure you have at home. And they should send something home with you from the hospital to measure that in.
I feel sorry, Joe, I don't mean to interrupt you. I thought it was a really good segue to, what you should do, in terms of calling your doctor if you do have questions about that, or if there are some things that are coming up regarding drains, or maybe something else that we might not know about. When should you call your doctor?
Well, first of all, there's no silly questions. And you can always call your navigator too, if you have a navigator. Lots of times that would be my patient's first point of contact, was to call their navigator. But yeah, the things you need to call your doctor about. If you're emptying your drain more than every other hour and it's just red blood, you need to call your doctor. That's too much drainage and they need to know. They may say, let's watch it for 12 hours, or they may say, just come back on in. If you have a fever over 101 for more than 12 hours, you need to call your doctor. If you're having any pain you can't control with the pain medication they gave you, you call your doctor. If there's anything bleeding through your dressing, you'll have a dressing on your chest. If you bleed through your dressing, you need to call your doctor. I think those are the main things. Uncontrolled nausea. Sometimes nausea may be due to pain medicine. You may be having an allergic reaction to pain medicine because it may be something you've never taken before. So that could be a factor also. But know how to contact your doctor in the case of an emergency. And most of the times, if it's after office hours, that's going to be calling the hospital operator and asking them to page your surgeon or the surgeon on call.
I would say two things too. First of all, Leah, you have a drain behind you. Can you pull it out of the pocket of the resilience bra?
Yes.
Just show people what that looks like, because I never saw what it looked like. I wish somebody had said, this is what's going to be the tube coming. No, that's all right. No, you didn't. You may have, but honestly, I think this would have been very appropriate for a nurse when I was lining up my surgery to tell me this is what's going to look like. No one ever did. Not on you, Jill.
So this is specifically a Jackson Pratt drain, which is the majority of what most surgeons will use. Some of them use a wound vac. It's not very often, but majority of surgeons will use, this is called a Jackson Pratt drain.
JP, you'll hear it as a JP, and that's nurse lingo.
Yes. Jill, I don't know if you want to describe what all happens with this device, but
so from the point of about your pinky, from your fingers on what I see on the left, that's what's in your chest.
This right here.
Right. The rest of that's hanging out.
Yes.
So the bulb that you're holding actually has measurement marks on it.
Right.
You can actually, they're hard to read. Take a Sharpie and mark them. 1, 2, 3. It's, an ounce, 2 ounces, 3 ounces. And then there's a little spigot on the top of it.
Right here.
Just open that up, turn it over into your container, squeeze it out. And then with that squeezing, you squeeze that bulb and so it's flat then.
Right.
Your drain would be flat.
Right.
And you put the top back in it.
Right.
And with that being compressed, that's all the suction that needs to pull that fluid out of your chest.
Right. And typically when it's inserted into the chest wall, it's not going to be this round unless it's full of fluid. It's typically it's pretty
right.
small and compact. Yes, exactly.
Yeah.
No, so, I think that's it's very important for people to know.
Yeah, if you pinch that tubing and compress the bulb, it'll stay compressed.
Yeah. Okay. And then so in that drain, when I got an infection, I felt off, and that fluid was not red anymore.
Right.
It was pinky white, and I remember telling Leah, "This isn't right."
Right.
So that was another reason, would you say, to call your doctor if something changes with that color?
And if it's different, if it doesn't walk like a duck and quack like a duck, it's time to call your doctor.
Yeah.
Infections are rare, but they do occur. You never want to rinse that drain out. And this is very important. You never want to rinse that drain out because that's a direct line into your chest wall.
Mm-hmm.
You know, people think, well, maybe I should suck some water up into it and rinse it out. No, don't do that.
Here you are. These are the things that people never tell you. We're telling you.
Right.
You're going to wish you would have known
the
those.
good, the bad, and the ugly. It's all here.
But you know, you could go on for the what ifs, but now's the time to take a deep breath, know that the cancer's out, know that you're on your way to recovery, and just take a moment to be thankful for that little piece.
Right.
That part of it is behind you.
Absolutely. Yes. So, okay. So I'm going home a little nervous because I'm worried about what could happen if I'm home and not in the hospital. But I'm ready because, by golly, you're going to be ready to go home. I can promise you. But let's talk about something really important to me, which is clothing. This is not the time to put on your fashionable outfits, right, Jill? I think I had every zip up hoodie that my husband ever had, that I ever had, ready to go at a moment's notice, as well as a lot of button up tops. What would you say, Jill, to be mindful about in terms of clothing?
Button up tops and button up pajamas. It's really important. A lot of us, especially like if it's wintertime, we go sweat shirts that we pull over our head, but that's not really an option for a mastectomy patient post-operatively for the first few weeks. So button-up shirts, a flannel shirt, something warm, a zip-up hoodie that zips all the way, not a 3/4 inch, comfortable pants. Remember, your surgical side, your arm is going to be a little sore. So something easy to get up and down, not buttons and zippers and just pull on pants.
Cozy, comfort, and accessible.
Right.
You have doctor's appointments that you have to go to. And as much as you might want to look nice to go to the doctor, this is not the time to be worried about that, because you want to be easy, accessible to be examined, show what's going on there. And so definitely cozy, comfort, and accessible. And tell your friends that, because they're going to want to support you and maybe buy you something or help you have something cozy to recover in. But button up is critical.
Because remember, every time you go to the doctors, you're going to take your shirt off.
Yep.
And take your bra off.
Humility is out the door at this point. No one
Yep.
has it at this point. That is for sure.
Everybody's seen your bosoms.
So we talked about clothing. We talked about, the immediate kind of tactical stuff about recovery. So I've recovered. what happens next? Like, what does monitoring look like for me for the rest of my life as it relates to breast cancer?
Well, you're always a survivor. So the first 2 years, they're going to watch you very closely. So typically for a lumpectomy patient, they're going to have surgery, radiation. So they will have their first mammogram 6 months post radiation. Now, this will be a diagnostic mammogram, just as they brought you in and you had originally had your screening mammogram. They found something, they brought you back for a diagnostic. So the good part about the diagnostic is because you've had surgery on your breast, they've changed the landscape of your breast. So they can't compare the same apples and apples. They have to make a new landscape. The other good thing about a diagnostic mammogram is when you leave, you have the results. You're not waiting on a letter in the mail or a pop-up from my chart. You're going to hear right then, I don't see a thing. Everything looks great. We'll see you in 6 months. And then you go back outside with that biggest smile on your face going, oh, that felt good. And you're calling everybody. And yeah. And so that'll happen every 6 months for 2 years. Used to be 5 years, but we've backed that up a good bit. For patients who've had bilateral reconstruction, that may be an MRI every other year. We've taken your breast off, so there's no breast tissue there to look at. But to get a good picture of what may be around or behind that implant, an MRI is the only way to image that. And some women have to proactively ask for that. So women who've had a single mastectomy, they'll have a mammogram on one side and maybe need to every year or every other year have an MRI, a breast MRI.
And I think, we talk about, what does this look like physically and going back to the doctor and getting monitored. But I think one thing that gets overlooked a good bit is kind of that emotional and mental healing process of once you've had that surgery and now you're in that recovery stage and you're moving past, how do you kind of get back to your normal life and kind of, move that away from your mind and kind of take that dark cloud away and just get back to normal. And, I can't think of a better person to talk about that than an actual patient that's been through it, like Nancy. So, Mom, can you tell us a little bit about what that looks like for you and moving past it?
So one of the things that I talked about was how I feel when I meet someone that's had breast cancer, and we can kind of share our war stories together and how I feel the sense of pride and for that person. Jill, you've seen thousands of patients over your career. What type of support have you seen that works well for women, and what do you suggest, and what types of things have you seen that help people really feel this community that I feel when I meet someone?
I think support groups are different for everyone. As we see younger women being diagnosed, sometimes they're great with online support. There's support groups particularly for women under 40 who have different issues than people who are over 60.
Yeah.
And an in-person support group can be great. To walk into a support group for the first time and be surrounded by 15 or 20 other breast cancer survivors, and somebody says, well, how long are you post-op? And you go, 26 days. And you say to somebody else, well, how about you? 25 years. Woohoo! Support groups celebrate milestones. End of radiation, end of anti-hormone therapy, birth of grandchildren. It's so nice to be able to come out and go, there's lots of other ladies like me who are living a great, wonderful life. And I think that's important for us to see, and those are important stories to share. So online support groups, in-person support groups. Again, if you have a navigator, ask them where that support is available.
Yes, I kind of smiled, Jill, as you're talking, because I do go back for that mammogram, and sitting in that waiting room, waiting on the results, which I love, by the way, that I'm going to get an immediate result. I don't have to wait. But that waiting is hard. But boy, does it feel good when there's a good report that comes out of that. So I am diligent about those checks. That's how I can take control. That's how I can prevent this from happening to me again. I have a great sense of pride in what I did, and a great sense of pride in my family for the support that they gave me, because I couldn't have done it without them and my friends. But my family was there for me. So supportive in terms of emotion and, of course, physical support. But I have a great sense of pride, and I wear it with honor, because whenever I talk to women who have had breast cancer, and you start talking about comparing your stories, I have great pride for them too, because this takes a lot from you, and there's a sense of strength that you never knew you had until you had to show it. And so I think, Leah, that you know this. I'm it's always in the back of my mind, but it will never control me. Um, but I look back and I think, wow, I'm a better person for it. And I am, because life is hard, and it's just, every this just prepared me for the rest of my life, for whatever I'm going to face. So I wear it with honor.
I think that is very well said, and I see that every day. That's why I always say that you're my biggest inspiration. So it's really difficult when you see someone you love go through that, and at the same time, I've gained a lot of strength from watching you go through that, and I feel like a lot of parents will probably able to see that in their kids and have to go through adversity at a young age. It's hard for both a parent and a child standpoint as well. Um, but I think this was a really special episode that just really confirms a lot of those questions around post-op, and questions for your doctor, and the emotional and physical healing of, getting back to my life post-surgery, whether that's a lumpectomy, mastectomy, breast cancer diagnosis, whatever it may be. Moving forward is key, and having the knowledge to do that is really important, which is why we're here. And also providing you with the best recovery that you can possibly have is exactly why 3 Strands and the Resilience Bra exist. So I want to thank Jill again so much for all of your help, all of your knowledge that you've given around post-op recovery. We look forward to our next episode, where we're going to discuss all things post-surgical bras. If you guys didn't already guess it, Jill has been an advocate for the Resilience Bra, which is the post-op bra that we created since I initially started the concept after my mom's diagnosis with breast cancer in 2016. Post-surgical bras are a very important part to post-op recovery, yet there have been little to no advancements made for decades. We're going to discuss the importance of post-op bras after surgery, and why the Resilience Bra could be a game changer for you during your healing journey. If you have any questions around the Resilience Bra for your post-op recovery, head over to www.3strandsrecoverywear.com, or if you have any questions, reach out to us at info@3strandsrecoverywear.com. Thank you guys, and we'll see you next time.